Patty's here. This is so great. Welcome, everybody. I'm so excited to see so many people that I know and love and that I know are really well positioned to use the information we are going to get today. I'm so delighted to introduce Dr. Jennifer Herring, who is the 2 month in appointed executive director of the Worcester Educational Collaborative, WEC, as we know it here in Worcester. Um, and WEC has played a really important role in shaping our schools. Jennifer Safford's here. Great. Oh, this is delightful. Um, WEC has played a really important role in our community, and I feel like you're positioning yourself right out of the gate to continue to play a really important role in education in Worcester, and and a role that nobody else is even really considering it feels really progressive to be thinking about this, and that's what's so exciting to me about um, this presentation today. So welcome everybody. We are recording it and we'll post it as soon as possible so you'll be able to share with your colleagues. It feels like we're going to want other people to understand what we understand after Jennifer drops all these knowledge bombs on us. And I have the beautiful Kelsey Hopkins here. She's also assisting me. Kelsey's going to do slides. And I will do my best to monitor the chat. And Jennifer, however, people who are just arriving, thank you so much for being here. We're thrilled to have you for this really important topic, and we are already planning that we're going to probably want to do a part two in for September's Trauma Training Tuesday. So that being said, we're going to hope to create the space to really dive into this content that feels so important. And I will now stop talking and hand it over to you, Jennifer.
Thank you so much, Amy, for having me and for that awesome introduction. Thank you, everyone, for hosting me. I'm so excited to speak with you today about how trauma impacts learning and how we can start the conversation as a community, and looking forward to this upcoming school year and really supporting students, supporting Worcester Public Schools, and really moving the work of trauma-informed care forward. So I think Kelsey will be helping me with our slides.
Yep, gotcha.
Um,
I'm gonna share now.
and so for today's discussion, we'll have some lecture, some video, some discussion, and some personal writing and journaling. So I'm hoping to give a diverse options for people to learn and internalize the information. If you have any questions or comments you'd like to contribute to the space, please feel free to come off mute and just shout it out. I can't see you while I'm presenting, so I'm totally happy to pause the presentation to allow folks to engage in any way they would like. Um, so again, thank you so much for having me. I'm Jennifer Herring. I'm the new executive director of Worcester Education Collaborative. I'm so proud to be doing this work and so excited to be leading this wonderful team and walking alongside Worcester Public Schools to increase positive learning opportunities for all students. So a little bit about me and my background. Previous to my role at WEC, I was a teacher and an administrator in many urban schools in Framingham, Randolph, Cambridge, Boston, and Lawrence. I also am an adjunct professor at Lesley University, my alma mater, where I earned my PhD in educational leadership, focusing on supporting sexual trauma in schools. I teach in the LIFTS program, which is the Lesley Institute for Trauma Sensitivity. So we do trainings with school personnel around creating safe and supportive schools for students across the Commonwealth. I also speak a few languages. My family is from Haiti, and I also learned Spanish in my personal and professional relationships, and I also happen to have deaf family members. Um, I have my master's of education in psychological studies and a bachelor's in theater. And I also just recently published my first book, sexual trauma in educational environments. And so I have linked an image to that book at the end of the slide deck. If you'd like to take a picture or Google or contact me offline, I'm happy to help you obtain a copy if you would like. Okay, so these are some upcoming things that are happening at Worcester Education Collaborative. Our vision is to collaborate with Worcester Public Schools to support positive learning um, outcomes for all students, and really focusing on literacy and numeracy. We know that since the pandemic, the data around literacy and numeracy has decreased. So our job and our focus this year is to get folks in schools really excited about increasing those opportunities for literacy, learning, and numeracy for all students. Some of our upcoming events coming up. Our community listening session in October. We really want to hear from you and additional community leaders and community members and families around how WEC can best support you moving forward. We are celebrating 15 years at WEC, and this is an awesome opportunity to think about ways to build on the wonderful work that's already been happening. So part of the ways that we're going to do that is by hosting a listening session to help us create our strategic plan. We also have the Bassett Symposium coming up in November, which is our annual meeting. And so please feel free to reach out, go on our website and see how you can support. And if you would like to attend as well, there's information on our website. Okay, so our objective today is to be able to examine historical events that impacted development among people and that have been impacted by that event, and to be able to identify the influence of epigenetics and historical trauma on learning and the brain. So before we jump into the content, I would invite you to take a moment to think about what are your hopes and dreams for the class of 2038 and all students in Worcester? So we know that all students who were born during the pandemic are starting kindergarten this year. So one of my personal and professional focus areas this year is to really think about how we're being intentional about collaboratively building safe and supportive schools for students who've experienced trauma, namely students who were born in the pandemic. So take a moment. Okay, I would like you to keep that question in the back of your mind as we're going through our conversation today, and we'll have some more time to discuss and to reflect as well. Okay, so childhood trauma across the lifespan. So we won't watch the whole video, but this video is a TED Talk by Dr. Burke Harris, and she talks about her experience as a medical doctor and pediatrician supporting students in an underserved community who are experiencing adverse childhood experiences. After we watch the video, we'll have some time to reflect. We'll go into some breakout rooms to discuss what we learned, and then we'll bring it back to the main group.
Thank you, Kelsey.
Yeah, I think she's
the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or packaging chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence. Now, for a long time, I viewed these things in the way I was trained to view them, either as a social problem, refer to social services, or as a mental health problem, refer to mental health services. And then something happened to make me rethink my entire approach. When I finished my residency, I wanted to go someplace where I felt really needed, someplace where I could make a difference. So I came to work for California Pacific Medical Center, one of the best private hospitals in Northern California, and together we opened a clinic in Bayview Hunters Point, one of the poorest, most underserved neighborhoods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle, and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities: access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, "Dr. Burke, have you seen this?" In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. Some people looked at this data and they said, come on, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand, better than we ever have before, how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear.
I had a health condition, and you hypnotized me, and in 20 minutes, that health condition disappeared. I was mind blown, and that.
Thank you. Okay. So let's give me Kelsey a minute. I just want to make sure that I'm on track with our time here. Let's get set up for our breakout rooms. And the prompt for a breakout is to read, reflect, relate. So reading, we've already engaged with some research from Dr. Burke-Harris. How does Dr. Burke-Harris's claim support ACE studies, which are the adverse childhood experiences she discussed? What are some important differences and similarities you observed in ACE studies when it comes to being exposed to a traumatic experience or not? And how does the video and the research about ACE studies relate to our work in schools or in our daily context?
Jen, how many, 3 to 4 participants per room sound about right?
Yeah, that sounds good.
All right. I've created those breakout rooms and you will be invited to go there now.
Welcome back, everyone. Before we continue with the presentation, I was just wondering if anyone would like to share any reflections or anything that came up in your conversations. I do have one question I'd like to ask that I heard, but I want to give other folks a chance first.
I would like to say I wasn't familiar before with the ACE study, and I was very impressed by the summary that Susan gave in our session.
Yeah.
Very helpful.
Yeah, I absolutely loved watching that talk again. Dr. Burke-Harris's talk was very formative for me as I was going into medicine. So very cool to rewatch it. I think our group, we were both clinicians, so we discussed kind of, I think trauma really serves as the backdrop of a lot of the interactions and care that you offer for patients and kids. I work in the pediatric ICU, and even in that setting, you have isolated medical traumas, but everything that a family or kid is before they come into the hospital comes with them and really sets the tone of how they navigate this really traumatic event that they're going through now. And so I think being mindful of that and recognizing that changes how you can support them. I mean, I think it's very important work and was very foundational for me going through my training.
Thank you. Anyone else?
I'll share. I really enjoyed speaking with the two other gentlemen in the group. And I think what I heard from all of us was how it feels very validating to know that there's a concrete
Yeah.
evidence that, what we are experiencing as adults, there is scientific, it's not like all in our heads. It's truly tangible. And the other thing I loved that Jordan said was, the use of this maladaptive behavior when in fact it's not maladaptive. It works
Yeah.
great,
Yeah.
and it can be a strength. It can be a strength. So I really appreciated that.
I can just share that I was in with Kim Davenport. We were the only ones in our group. So one of the things that we talked a little bit about was that I'm not a clinician. I'm an educated person, but not a clinician. So one of the things I was saying is it would be nice to help parents, caregivers, educators, others understand the work in trauma is not to ask non-clinical individuals to become clinical individuals or clinicians. The work is to have them be partnering in the work at their level. And I think that that's a message that sometimes gets lost. We're not asking people to be clinicians. We're asking them to do complementary work and let the clinicians be clinicians. And then the only other thing I wanted to share, as I'm a parent of kids with special needs, mental health, things like that, and I'm a veteran with PTSD myself, is that I know this is sort of a step in a different direction, but it was already
That's okay.
mentioned, helping families and caregivers
Yes.
do the work that they need to do. So again, that complementary work of the self work and then the prevention in, the youth and the kids, so that that whole cycle gets broken moving forward.
Thank you. Was somebody coming off mute? Okay. Not to put Carrie on the spot, but I was able to pop into her small group, and the question we were talking about how trauma feels like it's happening more often and more frequently and with more intensity. And so the question came up, is it that trauma is happening more, or are we in a culture where we recognize and acknowledge it more? So I'm offering that question to the group if anyone would like to answer from their perspective.
Can you clarify that, Jennifer?
Sure. So we were talking about how it seems ever since COVID that trauma seems to be happening more often and more frequently, especially with students. But then the follow-up question to that was, well, is it happening more, or are we talking about it more? Because are we culturally more aware of things like trauma and people's lived experience?
I
think
think
I
That's
think
clear,
both
yeah.
things are.
Thank you.
I think
sorry.
it's a combination of we're talking about it more, but the kids are also being exposed to it more. It's a combination of both.
Yeah,
Yeah.
I agree with that.
I agree. I was going to say both
Yeah.
things are true. I think trauma, bad things have happened to people since the beginning of time,
Yeah.
right? And it's great that we're now recognizing that these things are having an impact and how they're impacting us. But also at this moment in history, there really is sort of intentionally inflicted trauma being put on vulnerable populations. And even when it's in that sort of macro level, I feel like it's really impacting people in ways they might not be aware of. Certainly impacting children.
And right now, we have a terrible situation of what's going on with ICE, and the rest of the current administration is truly authoritarian, and it's affecting everybody. It's traumatic. It's the whole government is traumatic. What the government is doing, it's even traumatizing the state government. So it's tough.
I think both are true because, like everyone's saying, there are certain groups who have always experienced high levels of trauma. But what's changed is that, social media is new. And, the rates of suicide and depression in our kids, that's something that no one since the beginning of humanity ever had to endure. And so those of us in parental roles as Gen X, millennials, grandparents raising grandchildren, for the first time, I think in humanity, it's like it's so different that we don't possess the skills to help them navigate that. But I think that the trauma is spilling over into every, like they said, there's always been suffering. Life used to be brutal, right? But I think now it's everywhere, and because of social media, our brains were not wired to process so much information so quickly, and so we are feeling trauma. It used to be like, in our community or our village or whatever, and now we are seeing and feeling trauma on a personal level and on a worldwide level that humanity has never experienced. And I just think it's too much for our brains to process.
Wow.
Yeah. And there are, especially immediately post the pandemic, rates of child abuse, rates of community violence, were higher, acutely increased in especially the 2 years following the pandemic. And so I think there are also public health trends to show that there are increased adverse events that were going on. And then, of course, certainly now with everything going on with our presidency and government, the fallout of that is also going to be something we'll have to deal with. Yeah.
Can I raise a question about how we might be able to reinterpret trauma? I'm a social psychologist and teach psychology, and I also do counseling for couples and sometimes individuals. But there's an important theory in sociological psychology called symbolic interaction that Kenneth Burke is the chief author, that if you're interested in following up on that. And Irving Goffman, an excellent writer who has millions of books have been sold. But the idea is it's different than the old conditioning. I also took in graduate school, studied conditioning theory. And in the true model of conditioning, it's not just the stimulus leads to the reaction, but the interpretation of the stimulus, which actually is entirely in agreement with symbolic interaction. So do we react and interpret, or do we interpret and react? I wrote down. And if the situation is interpreted as potentially adding a good, then we may be able to deal with it better. One example I had in my mind was people that have had injuries and then work out and take an aggressive reaction to the injury. For instance, when I was in the YMCA pool reacting to a stroke I had a number of years ago, there was a fellow there who had just had both knees replaced, and he was there actively exercising, which he was supposed to do, and reacting to that trauma, as was I with reaction to the stroke, which has now I've reacted enough that it really doesn't bother me that much. But that term of the stimulus and the response, and also the end of the lecture by Dr. Burke, I didn't catch the last name, but the bear and the fear in the forest. I taught a course actually in the Massachusetts Treatment Center, used to be called the Center for Sexually Dangerous Men. I had 12 students, And during the break time, they got over and they talked with the guard, actually the correctional officer, and they said, "Oh, you go bear hunting." And he said, what do you do? You know, if the bear comes at you, and he said, "Well, I do have a pistol, but I mean, I do have a rifle, but I have a pistol, and then that's between me and the bear." But
Wow.
I kind of thought it was interesting that those guys were interested in how he reacted. One other point I want to share with you.
All right.
I mentioned something in class just quickly. One of my students in the class, I said something, I wish I knew what it was. And he was in the second row, and I had 12 students. And he said, "Yeah, that's why I'm here." And I could interpret that that was an actually, um, regret that he had done whatever he did for being there. I don't know what they did, but you may know they signed themselves in there for a day to life until they are cleared by psychological review.
Thank you so much for sharing. And I would definitely be interested in looking into that resource you shared about the research on symbolic interaction. Okay.
There is a website, by the way, Dr. Jennifer Herron, Jennifer, if I can call you that, or Jen.
Sure.
It's called the Society for the Study of Symbolic Interaction. And
Awesome.
there's tons of research there.
Thank you so much. So let's move on to the intergenerational trauma definition. Um, so we talked about trauma among children who've experienced adverse childhood experiences. When taking a step back, though, from those students and their experiences, um, we know that intergenerational trauma, and I think someone put it in the chat earlier, intergenerational trauma has a big impact on families, students, and how people navigate the world. Um, so I want us to watch a short clip of generational trauma. And then after that, we're going to go into a discussion on historical trauma and how that impacts learning. The first part of historical trauma comes from research from Kimberly Crenshaw, and she talks about intersectionality. And what she says is that the multiple aspects of our identity and our lived experience can come into contact and oftentimes in conflict with institutions of power and influence. So, for example, if a person is a female, maybe experiencing a disability or health challenge, and maybe has an auditory or language challenge, all of those identities that the person can experience would likely cause a more intense response to their intersectional identities, if that makes sense. Does anyone have any questions about that so far? Okay. And so, what I propose in my research and in my book is that when we think about intersectionality, historically, it's really talked about the challenging experiences of Black women specifically. Over the years, there have been additional forms of identity that have been added to that definition. Um, and so for me, I discovered in my research and in my interviews with my participants that survivors of sexual trauma in particular thought of their sexual trauma experience as one and the same with their identity because of how early it happened. And I think all of my participants in my research study across the board experienced sexual trauma as young as 5 years old. So that really made me think about how are we talking about identity, and what does it mean to now navigate the world feeling like your identity is not just about your race, ethnicity, and gender, whether or not you have a disability, but also that you are a trauma survivor. And so this is a quote that I pulled from some research about how historical trauma and intersectionality impacts lived experience.
Can I add a note there?
Sure.
talking about symbolic interaction.
Yeah.
Goffman, who was a superb writer, in fact, I know someone who is a well-known sports editor, and I mentioned Goffman's name, and he was familiar with him. Goffman wrote a book called Stigma. I would recommend that to people that would want to further understand issues about trauma as
Awesome.
others identify them. And as you said, if there's a stigma there, it's, is it something that is overcome by our own way of not accepting the stigma or overreacting to it, or friends who know about something that is stigmatic. I have a gypsy background, Romany background on my mother's side, and the gypsies, just for centuries, they have been downtrodden and mistreated, and they simply don't trust the gaucho, the outsiders, but they do not lie and cheat. They might react in a way that they do lie. They'll lie to protect themselves, but they won't cheat you. Trauma and stigma, and intersectionality, by the way, too. Just to say that people that started that, some of them that advanced it were symbolic interaction psychologists, sociologists.
Thank you for that. So we know that trauma impacts everyone, everywhere. We talked earlier in our discussion about how frequently and more intense it seems people are experiencing trauma. And so in my research, I learned more about historical trauma and the clinical and developmental and psychological implications for even just being part of a historically marginalized group. As I was growing in my career, I always heard the term, historically marginalized. And I always thought like, okay, that's just a kind way of saying a person of color or a Black person. But then I learned that there are really deep physical, even mental implications for even just being part of a group that is historically marginalized. I can give a personal example of I have a friend who is a nurse practitioner, a very close friend of mine. We grew up together, and I was sharing with her that during the pandemic, I experienced some really challenging health issues. I actually had a stroke in my early 30s, and the crazy thing about it is I had no idea it was happening at the time that it was happening. My blood pressure was through the roof. I was experiencing all these symptoms, but I kept going to work. I was just ignoring them until eventually I went to urgent care, and they had to use like 3 different blood pressure cuffs to try to get a read on what my blood pressure was. It was so high. And so this was during the pandemic. And so when I was able to reunite with my friend at just a family event, she said to me that she worked in Boston at the time, one of the major hospitals in Boston, and they found that more than half of the patients that experienced high blood pressure and literally walking around and having no clue that it was high are Haitian women. And ironically, that are small in stature. And so you think that typically the narrative is that people who experience high blood pressure tend to be overweight, maybe taller, and obese or at high risk for being obese. But I am less than 5 feet tall. When you meet me in person, you'll see I'm very small, as is my mom. But apparently women with our profile, specifically that come from Haiti, experience sky high blood pressure, and half the time don't even know until they get really severe symptoms that force them to go seek care. The reason that I'm sharing that is because we know currently there is a lot of trauma and a lot of um, concerning challenges happening currently in Haiti. And so when you think about a lot of the students that are coming to the US schools from Haiti, not just Haiti, but other parts of the world as well, but specifically in Haiti, when you look at the link to what's actually happening in Haiti and the lived experiences of the people that are coming from the island, it makes perfect sense why that is the case. Additionally, throwing a wrench in the textbook narrative of what's going on in Haiti and what's happening with Haitian people. I've never been to Haiti, right? My family's from Haiti. I speak the language. I was raised by Haitians. At the same time, I was born on US soil, and this is the only life I know. And yet, the challenges that Haitian folks are dealing with, given the condition of certain parts of the country, are showing themselves in the health of even US citizens that have Haitian blood in them. So that was just a personal anecdote to show the impact of historical trauma and how it can impact the individuals from that historical group. So why is it necessary to understand trauma and its impact on learning? As I shared, we never know where students are coming from, and we can't make assumptions about their country of origin or their language capacity and what they may or may not be going through. As an educator, I remember feeling very frustrated because the way that teachers and leaders would talk about students from certain parts of the world, there was an assumption about the trauma that people experienced even coming to the US. Now, while that may be true for some, it's not true for all. I've seen teaching and learning data that show that there are students that come from certain parts of the world that actually surpass US born students academically. And so we have to be really careful and be mindful of how we are telling the story of students that are arriving from outside of the US, and also making sure that we're not assuming that all students from a certain region or a certain area are experiencing trauma or are not able to excel or be successful academically because of our assumed trauma, if that makes sense. Okay, so we talked about it a little bit, but we're down to 1 hour left. The time flew by. So I want to try to get as much of this in as possible so that you all can feel like you had a rich experience today. Let's take some time to discuss as a group, how does trauma show up in your daily work? What are some things that you've learned, and what are some needs that you've observed in the community so far, just in your own personal or professional context? Anyone can jump in.
Jennifer. So I will share, it's not directly in my day-to-day work, but I wanted to speak to young children that are in early education and care programs and classrooms and programs across the city. What we've noticed over the last, 3+ years was a dramatic increase in, behavior challenges in the classroom. And they also I guess the tolerance level for the educators trying to manage that situation was also really very stressful. So we needed to take a trauma-informed lens to our work. We do a lot of coaching and support in classrooms around the community, and we had to ensure that we were using trauma-informed practices and supports for the educators, as well as introducing strategies for work for children so that the classroom could be a better environment for all of the individuals there, and that they could have strategies to move through their day and ensure children were getting the supports they needed, because clearly the bubble after kind of return from COVID was extraordinarily impactful on classrooms with young children, with a lot of children not maybe having all of their needs met yet. And so it all came together in those toddler and preschool classrooms.
Thank you so much, Kim, for sharing. That's really important. And we do know that, if I could just add really quickly, we do know that that is one of the biggest challenges in education now is behavior challenges in the classroom, and teachers feeling unsure of how to support students, because you have students with a wide range of experiences, many of whom have experienced trauma, and it's showing up in their behaviors. So it's not always necessarily a case of not having classroom management, but it's not necessarily having the resources and the support and the tools to really have everyone be at baseline so that they can be in a good place to learn. And most teachers are trained in their content alone. They're not necessarily trained for all the things that come in the backpacks of the students that they're teaching. So keeping that in mind is important as well.
I just wanted to share that although I'm not necessarily in the field right now, I think as a professional and as a parent and in all of my intersectional presentations, that consistency when we find things that work and like the great work that you are doing and talking about and implementing it is, I think, one of the hardest things. And what I mean by that is I always used to say, like in the Commonwealth of Mass, we're doing things 351 different ways and then even more different ways, right, in each of the school districts. And so I feel like when great people are doing great things and good work, one of the things that I think we can always do better with is how do we make that a more consistent presentation
Mm,
in the schools and in the Commonwealth, because that's how we get to equitable access. And I think I sort of learned that most other states do things typically in their by county, but because we're a Commonwealth and we do things by city and town, I really do think that sort of simple kind of logistical presentation really gets in the way of equitable access across the Commonwealth in a way that we don't truly understand.
yes, thank you.
I would just like to share something that I've been thinking about, and this prompts me to think about it. So I have recently had the opportunity to spend some time at the Worcester House of Corrections, and you will probably not be surprised to know that more than 80% have a mental health or substance use issue. And more than half are BIPOC, despite the fact that the region is about 10%. Another factor, which I honestly was not thinking about when I walked through the door, was that all of these BIPOC men were talking about how much they miss their children. And of course, you have to think, how much are their children missing them?
Yeah.
And I'm just wondering, how does that play out in schools and in the lives of families? For this particular population, they will be gone for a year or 2 years, which, is not the same as 20, but that's a long time in the life of a child.
Of
And
course.
it seems like there's services for, the folks that are incarcerated, and there's services for the children, but is their approach that wraps around the family?
Thank you. I'm writing down a note here. Yes, and parent involvement, is obviously so key. And going back briefly to something Kim said as well, is there's students experiencing trauma, and then there's the trauma of the adult supporting the student, right? So we can't, for thinking about intergenerational trauma, historical trauma, and COVID, which impacted all of us, all students at this point are being cared for by people that are dealing with their own internal challenges as well. So that's something to be mindful of. And how do we equip and support the adults and the caregivers of our students as well as our students? So it's a multi-layered process. Anyone else? Okay. We can move on to the next slide, please. Okay, so I would like to invite you to take 10 minutes to do a personal reflection. You don't have to share it with the group if you're not comfortable, but take some time to really reflect and write a personal statement about the importance of supporting students through a trauma-informed lens. That can be in school, that could be in out-of-school time, that could be in family, anywhere that you're comfortable writing about. Just the importance of trauma-informed work with students. Take 10 minutes. One more minute to reflect, and when we come back together, we will watch the intergenerational trauma video together. Okay, everyone, please pause your writing. If you'd like to continue writing while we watch, that's okay too.
Okay. Get passed down through generations. Stories, heirlooms, genetic traits. A new field of study is suggesting that even trauma may be passed down through the generations. Let's dive in. First, what is generational trauma? Well, it's exactly what it sounds like. Trauma that isn't just experienced by one person, but extends from one generation to the next. Here's child-adolescent psychiatrist Gayani De Silva to help explain.
If you have somebody in your family history who has suffered some sort of trauma, let's say racism or slavery or being the survivor of the Holocaust, that experience in your ancestors does get transmitted from one generation down to the next generation, to the next, and to the next, and to the next.
The concept was first recognized in 1966 by Canadian psychiatrist Vivian M. Rakoff. Rakoff and colleagues recorded high rates of psychological distress in the children of Holocaust survivors. A 1988 study found similar results with the grandchildren of Holocaust survivors. Since then, their descendants have been the most widely studied group, but in theory, any type of extreme, prolonged stress could have adverse psychological effects on children and/or grandchildren. How do health experts spot the signs of generational trauma? There are actually quite a few ways it could show up.
For when you're sitting with a patient, you would look for their specific signs of trauma. So you would look for mood issues or anxiety issues. Those are the primary big symptoms that people typically present with. And then you want to do kind of an investigation of why they feel depressed or they feel anxious or they're having some mood issues. And then you start to ask, why do you think you might be so depressed? Why do you think you might be so anxious? When did that start? Has it always been there? And so when people say, yeah, I feel like I've always been anxious, I've always been kind of depressed, and my mood has always been sort of irritable ever since I was a little child, then the lights got to go off in your brain. You got to think, oh, I wonder what happened before they were even born. I wonder what happened with their parents. Did any of your parents feel depressed or anxious? And then we'd ask about that. And then we'd say, oh, how come they felt depressed or anxious? Were they ever victims of trauma?
Even with all those symptoms for health experts to consider, there's no specific diagnosis for generational trauma, according to the DSM-5, which is the standard classification of mental disorders used by mental health professionals. But the phenomena of intergenerational trauma is well accepted.
It's a learned thing that your brain actually learns, and then the DNA actually learns it and then turns on certain DNA sequences versus other sequences, and it affects brain development. It affects how you learn how to regulate your mood. It affects how your limbic system, which is the part of your brain that is involved with managing emotions, how that develops. And it also has implications on how you react to stress.
Unfortunately, there are no easy answers, but generational trauma can be resolved if a holistic, intense intervention is put in place. This often involves individual therapy, though group and family therapy is another option.
Depending on how severe their symptoms are, so if they're anxious all the time, they're having panic attacks and they can't seem to function as they would like to function in their daily life, we might try medication. So something like a selective serotonin reuptake inhibitor. These medicines are like Prozac, Lexapro, Celexa, Zoloft. Those are kind of the common ones. And we would also highly recommend and want our patients to be in psychotherapy, because psychotherapy is going to help you understand where that anxiety is coming from, where that trauma is coming from, and help you put it in a way in your brain so that you can deal with it, you can handle it, and so it doesn't manifest in symptoms.
If you think you may be experiencing generational trauma, seek help from a behavioral health provider.
Teenagers are building.
Okay. So we've had a lot of dense information and really rich discussion. Let's take a 5-minute bio break. And when we come back, we're going to engage in a collaborative activity together that I hope you all will enjoy. So let's take a 5-minute break and be back by 1:27. Thank you. So the last part of the conversation, we're going to talk some more about the impact of historical trauma. So I read some research recently about the impact of World War I, the Holocaust, and transatlantic slavery. There was a whole study done on it and kind of compared and contrasted the outcomes and the developmental impact of folks who experienced all three world events. Additionally, I was able to look at some studies on the impact of the COVID pandemic as well. And so, what I'd like to do is just walk you through briefly some of the impacts that showed up in the research. And then we could have a discussion about just general reflections, especially about the impact of historical trauma on development. And then what I'd like to do as a pivot from the breakout rooms is if we could share in the chat a question that you would like to ponder throughout this school year, thinking about the class of 2038, thinking about our learning today together about how trauma impacts learning, how historical trauma impacts development, and think about a question that you would like to investigate or keep thinking about that came out of your learning today, if that makes sense. So the first event is World War One, and we could go to the next slide in the interest of time. The impacts, this is obviously not all of them, but these are things that showed up in the research of that literature that I read. This was the time in the world of the beginning of the acknowledgement of trauma as a result of PTSD. Prior to World War One, when folks, especially medical people in the medical field, mentioned trauma, they were really talking about injury to the head or the brain, which I'm sure you all are aware of. But as a result of World War II, this was the first time that, because soldiers were beginning to experience nightmares and triggers from the war in civilian life, that's when we started to realize as a society, there is such a thing as trauma that may or may not be related to an injury to the head or the brain. Next, not necessarily in chronological order, we know about the impact of slavery, and we're still seeing ripple effects today, especially in schooling. Again, not all students who are descendants of slaves struggle academically to be successful. However, there are studies that show a link between slavery and academic impact, especially in literacy. And that's something that will have to be part of the part 2 that we'll have together as far as the direct link between the impact of trauma and literacy and language learning among students. So some of the impacts, again, this does not cover everything, but what came out of this research was I guess, epigenetic, for lack of a better word. We didn't talk about epigenetics as much today, but that similarly to intergenerational trauma and historical trauma, talks about the forming and the building of your DNA based on the traumatic event. And so after estrangement from family, there were some shifts in the DNA and the genetic makeup of slaves and Black folks that came after them, as far as estrangement, your response or reaction to estrangement, and identity challenges as a result of slavery, if that makes sense. Physical labor, there are studies that show that Black people, particularly Black women, for example, tend to push themselves beyond their physical and mental capability because of the genetics around slavery and just the intergenerational trauma of being seen as basically a labor object versus human. And the last part of the study, not necessarily the least, but the study around how the Holocaust impacted Holocaust survivors and generations that came after them. We heard a little bit about that in the intergenerational trauma video, the challenges with erasure, just even the trauma of feeling like one's physical features are enough to want people to extinguish or annihilate you or the people that you came from or the group that you're a part of. Um, and so, some additional impacts of the Holocaust for survivors, according to the study, erasure and genocide, anti Semitic attitudes. We're still seeing, unfortunately, we're hearing news of that today. Certain influencers, celebrities, and really influential people in our society have either been canceled or been exposed for making anti Semitic remarks or acting in such a way that is anti Semitic. Obviously, PTSD is something that goes across the board, no matter what historical event we're identifying, and the impact of the fear of erasure on one's medical and mental health, to name a few. COVID pandemic. This might be a good opportunity for everyone to participate in the discussion. What are some impacts of the COVID-19 pandemic that we're still seeing today? Since we all were a part of experiencing that.
I worked in public health during the pandemic, and I still have some workplace and work trauma stuff. I haven't worked in a full-time role in a full-time job since the pandemic because of the work that I did during the pandemic, right? Um, and I know that's personal, but I can imagine that
Yeah.
how folks work and how we engage with work in professional settings has shifted for other folks as well. Yeah.
Thank you for sharing that. Oh, I see in the chat anti-vaccine culture.
I think
Um,
oh, sorry, go ahead.
Sorry. I just want to say also speaking on a personal level, my husband was a first responder during the pandemic and ended up having a problem with alcohol and is now in recovery. So I think that the secondary effects of trauma are sometimes just now being seen um, from the pandemic itself. And I think it just really heightened a lot of trauma survivors' reactions in addition.
Absolutely. Thank you so much for sharing. I saw something in the chat about isolation, social difficulty. This is something that I've seen as an educator. Students of a certain age, depending on what grade level they were entering or what grade level was disrupted during the pandemic. Many of our students to this day still have challenges with socialization, which is a huge concern of mine, because obviously, aside from the academic, the social piece is huge. As well as that kind of simultaneously happening with the rise of Zoom. Susan mentioned Zoom in the chat. Thank you. Um, between Zoom and the kind of inability or challenges to socialization. Those are two things that have been on my mind as far as how we're supporting students to get back into those healthy social relationships and interactions and using technology in a healthy way and not being so tech dependent.
I just wanted to add, tack on to what Amy said about isolation. So I was part of the NIH healing study during COVID, and a large group of very smart people, including doctors, made the assumption that people who were um, homeless and struggling with mental health and substance use issues, that their greatest unmet need would be lack of access to physical things and medicine and things like that. But when we surveyed them, they actually said that their greatest challenge was loneliness because all of the AA and NA groups had been canceled. So they didn't have access to online meetings. And so this sense of community that they depended on was instantly gone. And I think it was a big learning experience for all of us.
Thank you so much for sharing.
Susan, that brings up for me like coping strategies, right? Like that was one of a community point, but also it's what helps keep folks healthy and well. And the pandemic really interrupted and disrupted many of the things we use on a day-to-day level for coping strategies, and we had to find new ones and look for others, and some we just had to sit without, right, and live without. And I think some of that still persists today. I find that I'm every 6 months or so, I'm like, what are my hobbies? What am I doing for fun? What are those coping things? Because the fabric was deteriorated during the pandemic, and just to get back into regular life and to weave that fabric back together has been challenging, right?
Okay. Take one more. Okay. So thank you everyone for your for sharing about the impact of the pandemic. That is very important, and we're of course living the effects of that today. So the last activity that I'd like us to do is to take a moment, as I stated a little earlier, to think about if you could think of a question that you could think about and reflect on throughout this year as we're working towards building a more trauma informed learning community. Think about a question that you could ask yourself um, throughout the year. And I would like, if you're comfortable, to put the question in the chat, because then what I'll do is I'll take those questions and use those questions to drive our work together moving forward, whether that be a part two or whether that be our work with Worcester Public Schools. So I'm really going to use these questions to be intentional about how we're supporting trauma with our students in Worcester moving forward. So please take a moment to think about your question. When you have it, you can put it in the chat. Thank you so much. I know people probably have more questions they'd like to enter into the chat. As we're doing that, we have about 10 minutes left. I'd like to open the floor for any questions, comments, or reflections folks would like to share.
I'm appreciating the questions everyone's put in the chat and that the chat is shared so that I get to see them.
Yeah,
Thanks for this opportunity and activity.
absolutely.
I appreciated from Terry's comment about how much this trauma informed work and helping everyone to recognize the impacts really is like substance abuse prevention. It really is the work we're doing now with kids to address their trauma, to support their parents through trauma, really will won't pay off in the next year, but it will pay off immensely over the course of their lifetime. I think many of us in the audience have experienced trauma, and that's what brings us to this work and these spaces. And we know how much we've benefited from doing the healing work. And certainly speaking as a middle ager, I wish I had begun engaging in it much sooner. And I'm just feel like it really allows us to meet the potential of so many more young people when we address trauma is such a barrier to learning and to connecting and to relationships and to all the good stuff in life. And so the younger we're helping them and addressing it, the better all of their outcomes are going to be. You can really kind of see why the ACE study works, right? Like when all this bad stuff is happening and they're not getting the support they need, they're not, it leads to bad health outcomes. So, the opposite needs to be true. The more we support and address and recognize, hopefully we're adding on to the quality and length of people's lives.
Also, would like to highlight a question that came up in the chat of supporting families who maybe culturally it isn't as common or acceptable to talk about trauma openly. I really appreciate that because that is a huge portion of our society and our population here in Worcester.
I just wanted to add that so in some of my previous work with addiction, we did presentations for families of people struggling with substance use, and we talked about ACE. And of course, there's some amount of pushback because parents don't want to ever consider that something they did or something they didn't do could have contributed, but I think it's really valuable for parents to understand that it may have been something, it's cumulative. It may not have been this big horrible event. It may just have been the fact that you were a military family and you changed schools 25 times. This has an impact and you had no way of knowing what the impact would be. And I think also it's very valuable to share the hope of resilience. So building resilience. I think there's even a video that talks about the science of trauma and the hope of resilience to let people know that this isn't just us saying, "Oh, this is horrible," but there's things we can do to prevent. There's things that we can do to build resilience in families and communities. Because it's such a heavy topic.
Susan, you stole my thunder. That's how I wanted to end. Is to talk about something that you're hopeful for. So I don't know if people are done putting their questions in the chat, but maybe before folks sign off, if you could say one thing you're hopeful or optimistic of in this work of supporting students who've experienced trauma. I can start. I'm optimistic that we have a very collaborative community here in Worcester. I have felt it since my first day at WEC, and I'm so hopeful that we will come together and collaborate to find a better support for this challenge in our community.
I think one thing that gives me a lot of hope is really the power and strength of people in the community and the evidence and kind of intuition that backs that having strong supportive relationships, not only children having strong adult supportive relationships, but having strong community and interpersonal relationships really does mitigate some of the effects of toxic stress and adverse childhood outcomes. And so there is a lot of room to pull from the strength of our communities and our inner circles to really overcome this.
Great.
I feel so grateful for the people that are here today. Just, knowing that people are teachers, they're doctors, they're social workers, they're parents, and they're interested in talking and thinking and learning, coming together about this topic. Like that is so much cause for hope. And I really don't know that I ever imagined that there could be such a multi disciplinary way to come together, think about, talk about. And if we really address this stuff from all of those angles, like that's how social change really happens. So that makes me feel great.
I feel really hopeful because in some of my work, I hear parents sharing that kids are learning, like early childhood and kindergarten, that kind of, and under, they're labeling emotions in school differently with different activities, and they're learning breathing techniques and strategies from a really young age, and then they're bringing it home, teaching and sharing with their parents, their families, and that gives me a lot of hope. Yeah.
So, okay, well, thank you so much, everyone, for having me. I'm so thankful to have had this opportunity, and I hope we can meet again soon. I don't know, Kelsey, if you want to share my last slide, just has my thank you message, my email, and an image of the book I had shared at the top of the meeting, if anyone would like to obtain a copy. Um,
And
so,
Jennifer,
yes,
we'll share all of that too. We always
yeah,
create a landing page for each Trauma Training Tuesdays topic. And from that
awesome.
page, we'll have WEC on there, your practice, your coaching practice, your book. And I think that there's pretty clear agreement that there's a need for an interest in a part two. So I'm hopeful that we could do that um, even in September. I think this is really, I, there's so much meat here that's
I would
really
love to.
relevant to our quality of life and the quality of life of our community. So I'm so grateful that we have you in our community and that you were so willing to do this right out of the gate, and hoping to that we'll do another.
Awesome. I would love to. Thank you so much, everyone. I'll stick around in case anyone would like to chat with me or ask any questions offline.
Thanks again, everybody.
Thank you so much for this.
Thank you.